Ladies and gentlemen, welcome to the Health Insight NHSN Training Series 2 NHSN Facility Enrollment and Adding Users webinar. Your host for today, Tim Nelson, will now begin.
Good afternoon, and thank you for joining us for the second session of our three-part webinar series for NHSN enrollment. Those of you on today's webinar are participating in the initiative to report C. difficile infection rates starting with October's data that will be reported at the beginning of November. So my name is Tim Nelson, and I work in Health Insight's Utah office. I'm also joined by Lisa Barton from our Oregon office, who will be answering any questions that are submitted through the chat feature. We will also open up the phone lines at the end of today's presentation in case you have any questions that you would like to ask at the conclusion of my remarks. In today's webinar, we are going to review the steps that each facility's designated NHSN security administrator must take to enroll their facility into NHSN. Also, I want to point out that the presentation slides and other documents we are reviewing in today's webinar are available for download in the Files section located on the right side of your screen. During our first webinar in August, we reviewed required training, NHSN registration, and SAMS registration steps. Those are the first three steps that you can see there on your screen. After you complete the steps, you will receive a SAMS grid card in the mail at your home address. It does take several days to several weeks to receive a SAMS grid card. If you haven't received your SAMS grid card within 2 weeks after receiving your approval emails, send an email to the address shown there, samshelp@cdc.gov. And just by way of background, SAMS is the user authentication gateway that you must enter through in order to gain access to the CDC's NHSN reporting system, in case any of you are wondering why you register for both SAMS and NHSN. Also, once you have a SAMS card, it is yours forever. Meaning if you start working for a different facility, you would bring your SAMS card with you to gain access to NHSN if you were to have NHSN reporting duties at your new facility. That is why the SAMS grid card is sent to your home address, and it's also one of the reasons why you go through the identity verification process in Step 3. Also, I want to let you know that the web link in Step 2 of the checklist was broken for a day or two last week. If you got stuck on that step last week, please know that that link is now working again. Now on to the next slide, slide 3. If you missed session 1, you can access the slides, forms, and a recording of the webinar at the link shown on your screen. Once you receive your SAMS grid card, you are ready to begin NHSN enrollment. Your grid card will look like the one shown on this slide, but the grid card values on the back of the card will be specific to you. You will also need to have completed a paper version of the two forms that you can link to from this page. So the two forms that you can see there, the annual facility survey form and the facility contact information form. So you print those out and complete those before doing electronic registration online. The reason we ask you to fill these out on paper before submitting the information electronically is because you must submit the information in one sitting once you log in to do the electronic submission, and you cannot save a partially completed submission. By having all the information filled out on paper beforehand, you will be able to submit the information electronically in one sitting. You can access the SAMS homepage by going to the web address shown under the second bullet point on this slide in the SAMS grid card credentials section located in the second column. So that screenshot in the upper right, the middle column is what you'll click on to log in. If you have not already done so by this point, it's recommended to bookmark this page, as you'll need to continue accessing this page for NHSN setup and reporting. Next, you will enter your SAMS username and the password that you set up in Step 3. Then you'll click Login. Your username is the email address that you use to register. Once you have entered in your username and password, click on the Login button. You will then be prompted to enter in the requested grid card values located on the back of your grid card that looks like the picture on the screen. The values being requested change at every login. For example, this picture shows values being requested of D1, D3, and E1. Using your personal SAMS grid card, locate those values in the grid fields and then input them into the spaces shown and click Login. Once you've successfully signed in through SAMS, you will be directed to this screen to begin your NHSN enrollment. Click on the NHSN enrollment hyperlink to begin the NHSN enrollment process. And please note, if you do not see this NHSN enrollment link, contact the SAMS Help Desk at the address shown. They can get that added. We've had a few people that have had that link not showing. But if it's showing, you can click on it and you'll be directed to the enrollment page. At this point, you can click on the Access and Print Required Enrollment Forms link if you have not already printed and completed the two forms I mentioned earlier. Remember that both forms must be completed prior to entering the information electronically into NHSN. I'm highlighting that important point that you must submit all the information electronically in one sitting. So you'll want to print out the paper versions of the form and gather all the information beforehand before going in here to enroll the facility. So once you have that information gathered on the paper forms, you would click on the Enroll a Facility link shown in the screenshot. The annual facility survey document is a 4-page survey that collects information about your facility and the services you provide to your residents. You may need to talk with others within your facility to answer some of these questions on the form and make sure to be as accurate as possible. If you would prefer to have step-by-step instructions from the CDC for completing this form, click on the link that you see here at the bottom of this slide to access those detailed instructions. Once you have your two completed paper forms in front of you, you will click on the Enroll a Facility link to enter all the information that you've gathered electronically, or that you've gathered on paper, sorry. After you click on the Enroll a Facility link, you will see the screen shown here. An important title that I want to define here as we walk through these screens is the title of NHSN Facility Administrator. The NHSN Facility Administrator is the person that completed the initial SAMS and NHSN registration for your facility. And they are the person that will complete this electronic facility enrollment. This person is not necessarily the nursing home administrator, but could be the same person if that is who your facility designated to be the security administrator, but it's whomever your facility has designated to enroll the facility electronically. Fields with a red asterisk must be completed to save your work. You can see the designated spot here on the form where each facility will input their CMS certification number, or CCN. If you don't know what your facility's CCN number is, just contact me or Lisa and we'd be happy to provide you with that number. On this enrollment screen, you will select LTC Skilled Nursing Facility as the facility type. Also check the long-term care facility box as shown where the second red arrow is pointing. Finally, make sure to use the email address that you entered during SAMS registration in the email field near the bottom of the screen. On this screen, you will enter contact person for the long-term care facility. This is the person who will be most involved with long-term care facility surveillance. I would guess that in most of your facilities, this would be the person you designated as the security administrator. That's the person that's completing this electronic enrollment. So here is a screenshot showing more of the fields that must be entered. Again, I remind you all that fields marked with a red asterisk are required. You will not be able to submit unless you've filled out all those red fields. Once information is saved, a green check mark displays as shown here, and you can print a completed survey for your records. So if you do click on that print completed survey link, be sure to complete the next step, which is to click the save and submit button, because your information is not entered and complete until you've clicked that save and submit button. Once you've done that, you'll get a screen showing, like you see there in the bottom, where it says the enrollment for your facility has been completed. So you'll get that confirmation message. The facility administrator will then immediately receive an NHSN email titled NHSN Facility Enrollment Submitted. If you do not receive this email, contact the help desk at nhsn@cdc.gov. And the email will include a link to the to a consent form that's called Agreement to Participate and Consent. You'll want to print that complete consent form. It's a 3-page document that requires a form to be filled out on the last page. This must be signed by the long-term care facility's primary contact person and your facility leadership, meaning the highest level administrator at your facility. You have 30 days to open the link and print the form. The CDC must receive it within 60 days, and you'll fax it to the CDC at the number listed within the agreement. The NHSN facility administrator will receive an email notification of facility activation from NHSN 2 to 3 business days after they receive the signed consent form. And then, congratulations, you'll get this message that your facility's enrollment is now complete once you receive the email like the one shown. Now I'll just talk briefly about 2 related topics, which we'll get into more in depth in the next, our 3rd and final session in a few weeks. So first I'll talk briefly about adding additional users. The NHSN Security Administrator can add additional users that can be either primary or backup C. diff reporters. In fact, we recommend each facility have 1 to 2 additional users. You, the NHSN Administrator, must wait until you have the facility fully enrolled before adding additional users. So once your facility is fully enrolled, you can add additional users. Each person will have to complete the SAMS registration process to receive their own grid card. They will not have to enroll the facility, you've already done that, but they will have to complete the SAMS registration process. When you add them, when you, the NHSN Security Administrator, add them, they'll receive a Rules of Behavior email that, once agreed to, will generate an invitation to join SAMS. Also, the NHSN Facility Administrator must assign rights to each user, which we will cover in depth during webinar number 3. If you would like to add users before webinar number 3, contact me or Lisa and we can guide you through that process. Also, there's group functionality within NHSN. This allows us to better help you because we can see, number 1, like who's done monthly reporting. We cannot see patient level detail. Only people within your facility can see that, so you won't have to worry about that. We will send you detailed instructions outlining the steps to join our group, as well as the QINS NCC group. So the QIN NCC is CMS's national contractor supporting this work across all the states. You grant rights to them so they can see your NHSN data. So they look at it in aggregate form so that they can see overall infection rates. Now, it's important to note the QIN NCC reports only aggregated state and national level data for the purposes of quality improvement. Aggregated data reports may be shared with nursing homes and key national and state partners working to reduce C. difficile in nursing homes and communities. However, the QIN NCC will not share nursing home specific facility level results with CMS. So that can put your mind to ease with that, that they will not share facility level results with CMS. Oops. So you will receive a short survey from Health Insight to see where you are in the enrollment process, much like the one we sent out a week or two ago. We just want to keep following up with you to make sure we're giving you the assistance you need to get through the 5 enrollment steps that we've covered so far. That checklist that you can download in the file section at the right is your best friend. It really walks you step by step through the process, and feel free to reach out to us when you need assistance with any part of the process or if you run into any problems. You will receive an invitation to register for our final Session 3 webinar in a few weeks, and in that webinar we will review how to set up NHSN for your facility. For example, you will map locations and create a monthly reporting plan, and we'll go over adding additional users. Now, all these terms will make more sense during the webinar if you don't know what mapping locations means right now. Also, we'll go over the actual, so once you get everything mapped and set up, then we'll go over the process that you will do each month, reporting C. diff infections into NHSN, reporting your rates and infection data. So here's our contact information if you need to reach us. So we have our phone numbers and email addresses listed here. Lisa is the primary support person for Oregon and Nevada, and I am the person for Utah and New Mexico. And here we have just a list of references and resources for today's session material. And now I'd like to open it up to questions. So we will open up the phone lines and see if you have any questions.
Well, ladies and gentlemen, at this time, if you would like to ask a question, please press the number 1 key. Once again, if you would like to ask a question, please press the number 1 key. We have no questions at this time.
All right. If you do have questions, we again just refer to that one of those last slides that has our contact information. We've talked with a lot of you already, helping you with those first 3 steps, and we're happy to continue helping you. So, Lisa, do you have anything you'd like to mention or anything that came up in the chat?
No, there's nothing that came in the chat in questions.
Okay. Well, thanks for joining us, and if there are no questions, we'll end the session and hope you have a great day. Thanks for joining us.
Thank you, ladies and gentlemen. This concludes your call. You may disconnect at this time.